Hello, I am Subramaniam from SumanTV. Indian pharma industry has been protecting Indians for years together. However, Indians' lifestyle and food habits changed drastically. Because of that, so many people are suffering with the lifestyle disorders. One such is hypertension. And today, we have our beloved guest, Mr. Sheshiranjan sir, with us, who is having more than 30 years of experience in pharma industry, who has built the brands from zero to few crores of brands. And with his marketing skills and scientific skills, he has helped so many people who are suffering with disorders to get rid of their issues. Hello, sir. Namaste, sir.
Hi, Subbu. Namaste.
Sir,
Yeah.
doctors might be telling to so many patients, and people are also aware,
Yeah.
taking too much of salt inside the body is going to increase the blood pressure.
Yeah.
And once they take the salt inside the body, how it is going to increase the blood pressure, sir?
Yeah. Very interesting, Subbu. First of all, let me thank you for having me with you on SumanTV.
Yes, sir.
Now, salt, it's a real enigma. God has made a wonderful arrangement in our body that our kidneys handle salt.
Yes, sir.
The issue starts when hypertension is becoming an issue
Yes, sir.
because of this excessive salt intake.
Okay, sir.
If you see the way you said about the lifestyle changes,
Yes, sir.
most of the processed foods, outside food, will have very high content of salt.
Yes, sir.
At one point of time, kidney's ability to handle salt declines, and that is when the issue starts.
Sir.
Now, if you remember in our 6-7 class, we used to talk about sodium has affinity for water.
Yes, sir.
That if you put sodium in water,
Yes, sir.
it starts showing very specific activity.
Absolutely, sir.
Same sodium is there in form of salt in your body,
Yes, sir.
because salt is nothing else but sodium chloride.
Yes, sir.
So the sodium will pull lot of water from your body, tissue space into the blood vessels,
Okay, sir.
and the same blood will go to your heart.
Yes, sir.
So the amount of water or the volume of liquid which enters your heart
Yes, sir.
increases.
Because of the absorption of water.
Water into the blood.
Okay, sir.
So the blood volume increases, and the pipe which is your blood vessels.
Yes, sir.
They are being stretched beyond their normal capacity,
Yes, sir.
and the kidney is not able to cope up with the excess sodium.
Okay.
So there will be more mechanical pressure in your blood vessels, and that
Okay.
is called BP.
So you mean to say that, sir, because of the sodium's attraction for water, it attracts all the water into the blood vessels, the volume of blood will increase, and that is where all the problems will start.
Correct, because the return of blood from circulation to heart will increase.
Yes, sir.
So the pump will go under stretch.
Okay, sir.
It will has to apply more force.
Yes, sir.
And more force will get transferred to the blood vessels.
Okay, sir.
And that is why when you put the cuff of your manometer,
Okay.
it shows elevated blood pressure.
Blood pressure will increase.
Over a period of time, it will also reduce the ability of kidney to balance it.
Okay, sir. Okay.
Right, because kidney's health ability will come down
Okay. Okay.
as we age further.
Yes, sir.
Right. So that is how salt is first enemy of blood pressure.
Okay, sir. Okay. My next question to you, sir.
Yeah.
As per the government regulatory bodies or some health bodies,
Yeah.
is there any recommendation for the amount of salt people should take in a day?
Yeah. For a normal individual, WHO has very clearly prescribed
Okay, sir.
tables. The total amount of salt to be taken
Okay.
is between 500 milligram to 2300 milligram.
Okay, sir.
So when it comes to 2300 milligram, it is almost like 1 teaspoon.
Okay.
So that 1 teaspoon salt is for your entire 24 hours intake.
Okay.
Going beyond that, you are putting your body on the risk of developing hypertension.
Okay.
It's very clear. So it has to be restricted salt diet.
So you mean to say that, sir, WHO recommended to take not more than 2.3 grams
3
of
grams
salt
of
in a
salt
day,
in a day.
which is equal to 1 tablespoon
for
of
the
per
1
day.
person.
For adults.
Adults, yeah.
And then third thing, sir,
Yeah.
if the person is taking BP tablet
Yeah.
and he is also taking more amount of salt,
Yeah.
imagine, sir, nowadays doctors are writing 2-3 BP tablets.
Okay.
And then maybe general feeling, I'm taking anyway 2-3 BP tablets. Even if I take more salt, there will not be an issue. This would be the common perception among the people.
Okay.
So how do you look at it, sir?
No, this is dangerous perception, because doctors will use 1 medication and 2 medication.
Yes, sir.
That will depend on your personal profile as a patient.
Okay, sir. Okay.
If you have comorbidities, you have some other disorders,
Yes, sir.
or you are not responding, you are young, you are old.
Okay, sir.
But if you keep on taking the same amount of salt or put extra salt,
Okay, sir.
your hypertension medication will not be effective.
Okay.
But if you cut salt,
Okay.
your doctor might be able to reduce your number of pills, so pill burden.
Okay.
So salt anyway is going to be banal for the health of hypertensive patients.
And it derails the treatment plans
Yes.
also, I think.
And then you say BP is not getting controlled. Yes, it is not get controlled,
Yeah.
right? So both salt and sugar are poison for hypertensive
For the body,
patients.
for
Yeah.
hypertension.
If it is not taken in the restricted quantity,
Okay.
as per the HO recommendation.
Okay. So you mean to say that, sir, general understanding, because we got habituated for taste,
Yeah.
our taste buds have got habituated like
Yeah.
that. So the message is very clear. Even if you are taking 2-3 tablets for your BP control, you are not supposed to take more salt.
No.
So if you are taking salt within the recommended limit, and if you are taking tablets over a period of time, probably as per you, there is a chance that where you can reduce the number of tablets, even the dose of tablet also can be
Be reduced, but that will depend upon the doctor's judgment. And your overall health.
Okay.
Always remember
Yes, sir.
that the risk of cardiovascular disease because of hypertension starts increasing from 115 mm of age. Though we accept 140/90 as acceptable limit of blood pressure,
Yes, sir.
especially in that age above 50.
Yes, sir.
But more salt you take,
Okay.
more risk you have, not only for hypertension, but also for the related complications like kidney disease
Yeah.
or heart disease,
Yeah.
or most dangerous stroke.
Stroke also.
Yeah, because someday if
Yeah.
it shoots beyond,
Yeah.
and then you get hemorrhagic stroke,
Okay.
right? So
Okay.
situation becomes too difficult for a doctor to manage.
Control.
Right.
So you mean to say that, sir, in spite of taking tablets, people should consciously look into the amount of salt they are taking.
Correct. So that is, so we started by saying lifestyle.
Yeah.
So one of the important lifestyle change is restricted salt intake, and it has to be remembered
Yeah.
as the word for any patient who has been diagnosed with hypertension.
Hypertension. Sir, the next question is there any better alternative in the place of salt? Like white salt, we generally take it, sir.
Yeah.
There are some sayings in the public, like, brown salt or rock salt. Is there any better alternative for the
See,
salt, sir?
pink salt, brown salt, rock salt, salt will have sodium.
Absolutely, you are right.
Number
sir.
one.
Yeah.
Number two, there are options like low sodium salts,
Okay.
right?
Yeah.
But please understand, what is not natural
Yeah.
is not good.
Okay. You are right, sir.
So instead of evaluating various options,
Yeah.
now even doctors will not recommend you to take different kind of salts.
Yeah.
Pink salt is reported, but that is not much clinical evidence in favor of that.
Okay, sir.
It's better to keep the salt restricted.
Okay.
But always remember,
Yeah.
after age of 30-35,
Okay.
salt is going to make you hypertensive. Extra salt.
If you don't control it.
Leaf control. Number one enemy of hypertension.
To the humankind, in fact.
Yes. No, without salt you can't survive.
Correct.
But restrict.
Yeah.
So the best would be restricting salt to 500 milligram per day.
Okay. Sir, and there is one more question, sir.
Yeah.
Now, a person like me, for example, you take it, if I become super conscious, and there is a belief that, okay, less than 2 grams of salt is good, and I become super conscious and I started taking even small amount of salt.
Yeah.
Is there any health consequences because of that?
No. See, you will take some salt.
Yeah.
Number one.
Yeah.
Number two,
Yeah.
if you are taking 100% cooked food in the home,
Okay.
because it is not going to be without salt.
Yeah. Yeah.
Right.
You're right, sir.
There is a amount of salt which you are not aware in any food which you take from outside,
Yeah.
which you may not feel at all,
Yes. Yes.
right?
Yes.
But there will be salt.
Yeah.
Like in South Indian people,
Hmm.
you typically take pickles.
Pickles. Yes.
They are the biggest source of salt.
Absolutely, sir. You are right.
Even if you don't add,
Yeah.
so inadvertently they are taking excess salt already, even a small amount.
Absolutely.
Because,
Unknowingly.
Yeah, unknowingly you are taking.
Yes, sir.
So, if you are taking 500 milligram of salt,
Yeah.
minimum amount,
Yeah.
you are going to be happy, healthy.
So you are saying that less than half gram of salt, I mean close to half gram
Yeah,
of salt,
around salt.
in a whole day if you are taking, we will be absolutely fine.
You are excellent.
And then even BP tablets also can work very efficiently.
Efficiently they can work.
And we are not even troubling our kidneys, our
Kidneys,
heart, our
yes.
brain and all
Yeah.
these things.
That's very correct, Subbu.
And another point, sir, nowadays people lifestyle has changed significantly. It has become a fashion for people
Yeah.
going out and have the food in the maybe KFC or Burger Kings and all these places. and all these foods will have excess amount of salt.
Yes.
So how to look at this particularly?
No, they are going to be dangerous for anybody.
Yes, sir.
So there is nothing better than home cooked food.
Yeah.
So when you go and have food outside,
Yeah.
you don't know the amount of salt which you have ingested already.
Okay.
Number one.
Yeah.
Number two, all these people, they process the food,
Absolutely.
right? So it will have its own chemicals
Correct.
and preservative. And then you are adding salt.
Absolutely.
You are simply playing a very dangerous game with your body.
Oh.
At all cost,
Yeah.
this has to be avoided,
Yeah.
especially in children, because times are not far when the children will start having hypertension. It's not far from
Very dangerous. sir.
dangerous. So, and that is a fact.
Yeah.
The body weight, children with high body weight
Yeah.
are already having slightly elevated blood pressure.
Yes, sir.
So, taking food outside
Yeah.
is dangerous, and if you are hypertensive,
It is further
restrict it
dangerous.
to once in a week. That's all.
Yeah.
Don't
yeah.
go beyond that.
Yeah. Once in a week, at least they can go and have it.
Yes,
sir?
that's all.
Yeah.
Maximum once in a week.
So thank you very much, sir.
Right.
Hello, friends. So you would have heard, how salt is making our life miserable. So please follow a strict control on the salt intake. And anyway, going outside and having food frequently is not advisable. So salt is going to be a big culprit in your life if you don't have proper control on salt. So take care of salt consumption and have a great quality of life without having hypertension or without having stroke and these kind of issues. So thank you very much, sir.
Thank you, Subbu.
So
Thank
thank
you
you,
very
sir.
much.